Welcome back to Daytime Ottawa here on Rogers TV. Dr. Paul Roumeliotis is the medical officer of health for Eastern Ontario's health unit, and he joins me on the show today. Dr. Paul, welcome to the show, and a great opportunity, to give an update on both COVID-19 and, of course, the flu as well. Recently, the provincial government lifting many restrictions, and of course, moving into March 1st, looks like almost all restrictions. Dr. Paul, maybe just get your thoughts on that first of all.
Sure. I think that the government proceeded according to the data. So the data is showing us right now that the Omicron wave is now downward, which was what we predicted. And so we always had it in mind to be able to start removing restrictions. After the Omicron variant it peaked very quickly and it went down, but it really peaked at a high number. So I think it's the right approach. It's a stepwise approach. They progressively increased the numbers of people that can gather and so on. And then by March 1st, we'll have no restrictions whatsoever in terms of capacity, although there will still be masking. And at that
Okay.
point, the vaccine passport will be removed. But again, we're still looking at a scenario where we're much better off now than we were last year at this time. We now have a lot of people vaccinated. We have the third dose vaccination rate that's almost 60% in my area and 90% in people who are 80 and over. So we want to keep that going. We have antiviral medication. So I think this is a step into the right direction of living with COVID, having tools accessible to us now that can prevent admissions to hospital, like antivirals, third dose boosters, and a better understanding of it so we can open up and live with COVID as the pandemic fizzes out in the rest of the world. But from our point of view, we are going in the right direction.
Let's talk about the flu because we've seen
Mhm.
the numbers have declined quite a bit, and I think that's probably because we're using that hand sanitizer more, we're masking and that sort of thing. But so where do we stand with the flu season this year? What does it look like?
Well, it is a bit higher than it was last year. Last year was virtually non-existent. This year it's a bit higher. Again, very low as compared to what we usually have. And that, as you said, it is thanks to the fact that we now have masking in place, and all of the way that the flu spreads is basically the same way that COVID spreads. And so all the precautions that we have in place, masking, hand washing, staying home when you're sick, and so on, work for any respiratory virus in which obviously the flu is part of, and also the common cold as well. People are getting less colds. But what we've been seeing is a trend over the last, I would say, August, September, October into now, increasing in other respiratory viruses, respiratory syncytial viruses, for example, that cause bronchiolitis in children, and other cold-like viruses that are increasing. So I do expect that as we start opening up and not masking and so on, all these colds, including the flu, will come back. And there's no reason for us to believe that the flu is gone. It's a
Right.
temporary hiatus for the flu because the circulating predominant virus is COVID at this point.
So let's talk flu vaccine then. Many
Mhm.
people, of course, talking about the COVID vaccines so much so we've almost
Sure.
forgotten about this the flu
Yeah.
vaccine. So who should be getting the flu vaccine? Some of the most those the
Sure.
demographics that are most
Yeah.
important.
Certainly, the elderly, people over 65 for sure, people with underlying medical conditions, regardless of their age, and certainly young children should be getting it because it affects the both ends of the spectrum. Unlike COVID really affects the elderly, but the flu affects young children and the elderly as well, and in between, individuals with chronic medical conditions, hypertension, diabetes, and so on. And I think it's important to note that we can always have flu into April, and so if people want to get their flu
Right.
shot, it's still available, and we can co-administer it. Say you need your third dose or your second dose of COVID, you can get it at the same time.
Yeah, I was going to ask about that because some people probably wondering can I get the COVID vaccine and the flu vaccine? Is it safe to get both at the same time, or
Mhm.
obviously within a couple of days, couple of weeks from each other? How safe is it?
It is safe to co-administer it, to get it at the same time. Right now,
Okay.
we've got evidence that shows that it doesn't affect one does not affect the other. So you can get one in one arm and one in the other arm. I can tell you that moving forward, we're likely going to probably require COVID vaccination every year. And so for the fall, if for example there's a booster required for COVID and you need your flu shot, you can get it at the same time. Moving forward, I do know that the pharmaceutical companies are now preparing for one shot that will contain flu and COVID. And so that's in the future, probably in 2023. But at this point, there's no problem with getting both shots administered at the same time.
Excellent. Dr. Paul, always a pleasure. I know you're a busy man these days, so I will let you go. Thanks so much for joining us. Really appreciate you spending time with us today.
Thank you.
All right, take care. That is Dr. Paul. Of course, he is the medical officer of health for Eastern Ontario's health unit. Coming up after the break, we're going to speak to Jordan Hanley. He is the host and founder On the Line with. We'll be back with him right after this.